Hi there viewers, welcome back for another informative video on cardiac diseases. It's about the diseases that affect your heart and can cause severe killer issues, even fatal death. What is exactly a cardiac condition? The term cardiovascular disease, sometimes known as heart disease, describes a set of illness that affect your body's blood vessels and heart. One or more areas of your heart and/or blood vessels may be impacted by the disorders. A person may exhibit symptoms of the illness or not feel anything at all. Heart illness encompasses issues with the heart or blood vessels of the following topics: the irregular heartbeats, the heart valve illnesses, the plaque-induced narrowing of the blood arteries in your body's major organs, including the heart, having trouble relaxing and your heart pounding, issues with the heart and blood vessels from birth, issues from the outer layer of your heart. The prevalence of cardiac disease. In both the United States and the rest of the globe, the cardiovascular disease is the main cause of the mortality. Heart disease claims the lives of 6,55,000 Americans yearly. Cardiovascular diseases affects about 500,000 people of America every year. Both genders are affected equally. In fact, the cardiovascular diseases kills 1 in 3 women, and the people of various ages, nationalities, and socioeconomic statuses are impacted. What are the risk factors of cardiovascular diseases? If you have risk factors like these, you might be more prone to develop the cardiovascular diseases: elevated blood pressure, which is hypertension, the high triglycerides, using tobacco, diabetes, the heart disease in the family history, the obesity or the sedentary lifestyle, high sodium, high sugar, and high fat diet, excessive alcohol usage, toxemia and preeclampsia, and pregnancy diabetes, chronic autoimmune inflammatory diseases, renal illness, and that is chronic. What signs of heart disease are there? Depending on the etiology, the heart disease symptoms might change. A typical cardiac rhythm symptoms may include the rapid or pounding heart, chest pain, sweating, lightheadedness, respiration difficulty. The heart valve disease symptoms may include the dizziness, the tiredness, the chest pain, the heart fluttering, respiration difficulty, and many more. Blockages in the blood arteries of your heart, other organs, or other entire body may cause the following symptoms: discomfort in the upper body or chest, the neck ache, the either digestion or the heartburn, the exhaustion, the respiration difficulty, the sickness or vomiting, and the dizziness. Heart pumping problems may manifest as the swollen lower bodily parts, the exhaustion, the respiration difficulties. Symptoms of inherited heart conditions might include heart fluttering, not being able to withstand exercise, respiration difficulty. Symptoms of issue of the blood lining in the heart may include the sharp chest discomfort that usually becomes worse when you breathe deeply, exhaustion, trouble breathing, swollen lower body parts. It's crucial to remember that significant cardiovascular disease can manifest itself in women and older people even through the symptoms that are less obvious. What heart diseases test might I undergo? Typical examination used to identify cardiovascular diseases include the blood tests examine elements of the blood, such as the cholesterol and certain proteins that signify cardiovascular health. The electrical activity of your heart is captured by electrocardiogram. Wearable gadgets are usually in the ambulatory monitoring to monitor your heart rate and rhythm. The sound waves are used in the echocardiogram to provide a picture of your heartbeat and blood flow. X-rays are used in cardiac CT scan and to produce pictures of your blood arteries and heart. During a cardiac MRI, radio waves and magnets are used to produce pictures of your hearts. To elevate your heart response during a test stress, EKG, and pictures that may be used to stress in the heart in a controlled manner via the exercise or medication may be used. A catheter, a thin hollow tube, is used during the cardiac catheterization to access your heart's blood flow and the pressure. How may heart disease be avoided? Some forms of cardiovascular illness, such as congenital heart disease, cannot be prevented. However, making lifestyle modifications can lower your risk of several cardiovascular diseases. You can lower your risk of cardiovascular diseases by avoiding all forms of tobacco, taking care of other medical issues including diabetes, high cholesterol or high blood pressure, getting to and keeping a healthy weight, eating a diet low in salt and saturated fat, exercising for between 30 to 60 minutes a day on average, lowering and controlling stress. What illness of the cardiovascular systems are there? Cardiovascular illnesses come in wide range, including but not restricted to many of them. A problem with your heart's electrical conduction system, known as arrhythmia, can cause irregular heartbeats or heart rates. The valve disease, the heart valve issues such as tightening or leaking valves, structures that permit blood to pass from one chamber to another or blood chamber, are referred to as valve disease. Coronary artery disease. The arteries have an issue with your heart's blood, such as the blockages. So an issue with your heart's arteries that the blockages can be very fatal for your health. Heart failure. Problem with the heart's pumping and relaxing mechanisms cause fluid retention and breathlessness. Peripheral artery diseases. A problem with blood arteries in your arms, legs or abdominal organs, such as narrowing or blockages, is known as peripheral artery issues. Aortic diseases. Enrachment or dilatation of the large blood artery that carries blood from your heart to your brain and the rest of your body is a serious disease. Congenital heart disease. A cardiac condition that can affect several heart organs and is that is present at birth. The pericardial illness, which includes the pericarditis and pericardial infusion, is an issue with the lining of your heart. Brain blood flow issues, such as the blockages or channel constrictions, are referred to as cerebrovascular illness. Blockage in the veins and blood arteries that return blood from the body and brain to the heart is known as the deep vein thrombosis. Let's talk about the 10 heart conditions with strange names and how you may get them. Number 1. The Takotsubo cardiomyopathy, also known as the stress cardiomyopathy and colloquial as the heartbroken syndrome. The Takotsubo cardiomyopathy is a condition that results in a sudden weakness of heart muscles. This can be triggered by significant emotional stress, hence the name heartbroken syndromes. It can cause chest pain and breathlessness, similarly to a heart attack, but the condition is temporary and reversible. Number 2. The cardiac syndrome X. In the 70s, the scientists were left scratching their heads when the patient experiencing the angina, like the chest pains, didn't appear to have narrowings or blockages in the coronary arteries, the usual cause of angina. The condition got its name after a study of patients with chest pain carried out by researchers, the Robert Arbogast and the Marital Boruzza, produced some puzzling results. In one group, there were electrocardiogram ECG, signs of coronary heart disease, despite the fact they had normal coronary angiograms. Number 3. The Prinzmetal angina. This peculiar bronchier comes with the name of the American doctor, the Myron Prinzmetal, who published work on the condition in 1959. Also known as a variant angina, angina inversa or the coronary artery spasm, this is a condition characterized by the cycles of chest pain. The pain occurs due to the blood vessel supplying the heart going into spasm and preventing the normal blood flow. Treatment involves medication, including the nitrates and calcium's channel blockers. It is more common in women than men. Number 4. The Kawasaki disease. It is a rare condition which mainly affects children under the age of 5. It is thought to be caused by an infection, although the exact cause is unknown. Symptoms are a combination of fever, reddened lips, rashes, swelling of hands and feet, the red eyes, the lump in the neck. the swollen lymph nodes. In Kawasaki diseases, the blood vessels, including those of the supply of the heart, can become inflamed. This can go on to increase the risk of heart complications either at the time or in later life. Number 5. The torsades de pointes. The torsades de pointes is a dangerous abnormal heart rhythm that can lead to sudden cardiac arrest. It was first described by the French doctor Francis Desjardins. The name of this rare condition to the electrical waveform the heart produces of an ECG trace where there is no twisting and dwelling with the pattern. It can cause palpitations, dizziness, light headaches, and fainting, with a risk of death that is abnormal rhythm when prolonged. Number 6. The Tetralogy of FALLOT. The strange name feeds from the French doctor Etienne Louis Arthur de Fallot, who described it in 1888. These are: the pulmonary stenosis, the pulmonary valve or the artery is narrowed, the overriding aorta, the aorta of the main vessel, blood flows from the heart to the rest of the body, usually comes to the left side of the heart. However, in TOF, it is placed towards the right side, which means that the body receives a mixture of blood which is both high and low in oxygen. The ventricular septal defect. A hole between the two ventricles of the heart. The right ventricular hypertrophy. The muscle on the right side of the heart is thickened excessively. Number 7. The BARLOW'S syndrome. Named after the doctor who described it in 1966, the South African professor John Burton Barlow, the condition is a type of the heart valve diseases which affects the mitral valve and separates the upper and lower chambers of the left side of the heart. It helps to control the blood flow through the people in the hearts, and as a result, in people with the Barlow's syndrome, one or more of the flaps of the mitral valve is floppy and don't lose control properly. Also known as thick murmur syndrome, because of the sounds which can sometimes be heard with a stethoscope, it is one of the most common type of heart valve abnormality, though there are many patients with no symptoms. Number 8. The Epstein's anomaly. The condition was named after the Wilhelmus Epstein, a German doctor who first described the defect in 1866. The Epstein anomaly is a congenital heart disease defect in which one of the valves, the tricuspid valve between the right atrium and the right ventricle, is not closed properly, which can cause blood to leak backwards. As a result, the right atrium of the heart can become enlarged. Number 9. The Eisenberg syndrome. The Eisenberg syndrome is a rare complication of a heart defect when you are born with congenital. It involves a heart abnormality that can cause a hole to develop between the two chambers of your heart, allowing the blood to flow incorrectly within your heart, and at the same time is having pulmonary hypertension, which is increased blood pressure in the vessels in the lungs. Symptoms may not arise in the person until their 20s, when cyanosis may be seen. Cyanosis includes the bluish lips, the fingers, and the toes. The tiredness and breathing difficulties may occur, as well as the palpitations, the dizziness, and the chest pain. The main treatment is medication. Number 10. The Quinones syndrome. The Quinones syndrome is an episode of angina or even a heart attack triggered by an allergic reaction. The syndrome was named after the Professor Nicholas G. Quinones, a Greek cardiologist who found that the syndrome is caused by the chemicals such as the histamine and which are released by the body during allergic reaction. These chemicals cause the arteries that supply the heart with blood to go into spasm, thus limiting the blood flow and causing the angina-like chest pain. Treatment involves the use of medications to stop the allergic response such as corticosteroids and the antilysis and the adrenaline. If necessary, meanwhile, the treatment for the heart problems will also be carried out. Well, dear viewers, hope you have liked this video. Let us know in the comment section what your thoughts are about this video. And do not forget to take good care of your heart so that you can maintain a healthy life. Until then, eat healthy and stay healthy.